What is the peritoneum? So the peritoneum is a membrane, it's like a skin, that lines the abdominal cavity. So the abdominal cavity is like the bit in the lower abdomen between, well, if you think like the top of it, you've got your diaphragm, which is that sheet of muscle under your lungs. The bottom of it, you've got the pelvis. The front of it, you've got abdominal muscles, and the back, you've got the back. I mean, like the spine. And there's a whole bunch of important stuff in your abdominal cavity, and a lot of that stuff is protected and assisted by the peritoneum. So it provides protection for the abdominal organs. It kind of assists them, I guess, in that it's a type of membrane that's smooth, but it secretes like a lubricating fluid, so that when you're walking around or when you're twisting or whatever, organs like move past each other smoothly. It's obviously very important, and the reason that we'd be concerned with it is cancer sometimes spreads there. So a small percentage, maybe 5 to 10% of colon cancers spread to the peritoneum. Some gynecological cancers like ovarian cancer can spread to the peritoneum, or do spread to the peritoneum. In that the peritoneum provides kind of a route for blood vessels and nerves and lymph nodes. And of course, cancer can spread through the lymphatic system and through the blood vessels. Unfortunately, when cancer spread to the peritoneum, it's very difficult to treat. I mean, the peritoneum is like a membrane, so there's not like a massive blood supply to it, and of course, chemo is going into our bits of our body via the blood supply. So you're not getting a lot of chemotherapy drugs in there. And I guess it's even worse with molecular targeted drugs because they're huge. I mean, the molecules are really big. I think when I looked up a drug I was on called Erbitux, it was like 6,000 carbon atoms and a load of other stuff. Big molecules. Whereas some chemotherapy agents are only going to be, I don't know, 20, 30 atoms, possibly even fewer. So that's one issue. Another issue is that when cancer's in a peritoneum, it like spreads in a shotgun effect. So instead of having like one big tumor that you could potentially remove surgically, you tend to get lots of small tumors, a millimeter, a couple of millimeters across, spread over a large area. I mean, you can like cut away some of the peritoneum. It's called a peritectomy, I guess, and then kind of stitch it back together. I mean, it's like almost everything in your body, it doesn't actually grow back. So you'd then have a membrane with a big bunch of scar tissue in it, and that could cause problems moving, could cause surgical adhesions where stuff sticks together, and that's very serious, often requiring more surgery, and if you're unlucky, the further surgeries cause more surgical adhesions. So it's kind of difficult to treat surgically. Like radiotherapy is not really going to be any good because, at least currently, well, you've got a bunch of issues. First of all, lots of tumours spread over a wide area, which means you would I guess, have a very low dose of radiation over a wide area. It's unlikely to do any good and probably going to do quite a lot of harm. But also, you're very limited with radiotherapy when you're near the small intestines, because they tend to get damaged very easily by radiotherapy, and that damage is very serious. Another problem that compounds cancer in the peritoneum is it's difficult to see. So because the tumours are small and flat, they don't show up on scans very well. They're often too small to show up on scans. They're a bit more visible on a scan called a diffusion weighted MRI, which is I'm not sure if, I think that's just like you do on a standard MRI machine, but it's just maybe some settings that make it better at actually better at seeing fluids, and for some reason that allows you to see these little tumors better. But typically scanners see things that are like 5 millimeters big or 8 millimeters big, not things that are a couple of millimeters. I mean, a surgeon is only going to be able to see something about 2 millimeters across, maybe, possibly a millimeter. So when cancer is in your peritoneum, like in my case, it's very bad news. It does seem to respond to immunotherapy or immunotherapies, particularly the immunotherapy I've had, which is a combination of T cell therapy, NK cell therapy, and dendritic cell vaccine therapy. So when I had some surgery, my peritoneum was checked carefully by the surgeon, and he couldn't find any evidence of cancer there. One thing you may see on a CT scan is what's often termed like irregular thickening of the peritoneum, and that suggests maybe the cancer's there. So like in surgery, the surgeon will physically feel across the peritoneum with his or her fingers. So that's one way they might better find something. And then also they will take fluid from the abdomen and which are like abdominal washings, I believe they're called, and they'll analyze that fluid and see if there are cancer cells in there. That doesn't necessarily mean there's actually tumors on the peritoneum, but it's indicative that there may be. So it is a very serious thing when cancer spreads to the peritoneum. It doesn't happen a lot, but it happens enough. It did in my case. I mean, when my cancer was found, it was found already in the peritoneum, and when I was diagnosed in 2016, the treatment outcomes for people with cancer spread to the peritoneum were poor, generally. That's improved a bit because of procedures like HIPEC, heated intraperitoneal chemotherapy, and also just, I guess, more use of immunotherapies and things that do seem to help. Possibly another reason why I've done so well despite the cancer spread to the peritoneum is I've had a lot of hypothermia therapy, which is involved like heating cancer tumors, but the machine where that I've had for my hypothermia therapy does treats an area about 30 centimeters across. So I had it aimed at my liver, and it was getting quite a lot of the peritoneum, so maybe that has been helpful as well. A separate video on HIPEC, and also maybe there's another treatment if cancer spread to the peritoneum where like your abdomen is kind of inflated, and the surgeon sprays chemotherapy agent onto it, the membrane. So I'll do a video about that as well. I don't remember what it's called first. As always, please post your questions, and then I can make more videos, or if my video is particularly bad and your question is particularly good, I'll redo the video, which will help you and everyone else. So please do post questions, comments. Thanks a lot. And hit subscribe as well. And if you're watching on YouTube, hit the little bell icon as well, please. Thanks a lot.